It's actually an intestinal disease. It's actually a digestive disease that affects parts of your digestive tract. So first of all, we have to ask ourselves, what is digestion in humans actually? So how digestion in humans works is that if we do remember high school biology, the human digestive tract is made up of several parts. The first is your mouth, your trachea or your windpipe, your esophagus or your throat, your stomach, your small intestine, large intestine, rectum, and anus. Those are the main parts of the digestive tract. Other parts can include organs like the liver, the pancreas, and the bile duct, which also secrete hormones and enzymes that aid with digestion, but are not really part of today's topic. So now that we know the different parts of the digestive tract, first, how is food digested in humans? Well, first, obviously, you eat food, you put food in your mouth, and you chew it. You chew it as well as you can, and that it actually forms a ball, and that is pushed down into your trachea and through your esophagus through an automatic muscle response called peristalsis, and finally it reaches your stomach. And in your stomach, this is where all the digestive juices and acids are secreted to digest the food that you just ate. And once this process is done, it's passed further on into the small intestine, where the food is further digested by enzymes secreted by other organs in the body, and water and nutrients from the digested food is also absorbed through the intestinal walls. So once it passes through the small intestine, it goes into the large intestine, where it is now classified mostly as waste products, because it is made up mostly of undigested food, fluid, and older cells from the lining of the digestive tract. Water is further absorbed here, and in the large intestine, the waste products is changed from liquid into a solid. So this is why you need fiber. And in the last part of digestion, the waste product, which is now a stool or a more solid form of the waste product, is pushed into the lower part, which is called the rectum, and it's stored here until you have a bowel movement and you go to the toilet, and is pushed through your anus. So as some of us might know, the small and the large intestine is actually a very long organ packed really compactly into our stomach. But what happens when something goes wrong or something in our body does not work right? This is where Crohn's disease is one of the many different types of diseases that can affect your digestive system. So, first of all, Crohn's disease is an inflammatory disease. It's classified as a type of inflammatory bowel disease, meaning that it's not just your bowel, but also other parts of your body, such as the immune system. And what happens in Crohn's disease is that the digestive tract, there's chronic inflammation. So this means that it's not just inflammation for the purpose of healing the body, but it's always there. And this can affect different parts of the digestive system in different people. So for example, as I mentioned, the small and the large intestine are two very long organs in the body. But with people with Crohn's disease, it can either be one continuous part of the small or large intestine, or it can even be separate multiple segments of the small or large intestine. And this disease often spreads deeper into the layers of the bowel. It can be both painful and debilitating, meaning it affects your daily life, kind of disease, and sometimes it can also lead to life-threatening complications. And because we'll get into the cause later, but due to the exact cause not being known, there is no known treatments. However, Crohn's disease can be managed with therapies to reduce the symptoms, or maybe even put it into remission where the symptoms are no longer present. So as I mentioned, the cause of Crohn's disease is the exact cause is not completely known. Things like diet and stress used to be thought to be the cause, but now doctors understand that they are merely something that can aggravate the symptoms of Crohn's disease. Several factors such as genetics and a malfunctioning immune system are thought to likely play a role in its development. For one example, in the immune system, Crohn's disease can actually be triggered by a virus or bacterium, causing an abnormal immune response and cause the immune system to actually attack the cells of the digestive tract, which leads to inflammation, leading to the symptoms of Crohn's disease. So what are the symptoms of Crohn's disease? Well, they can range from mild to severe, and they may develop gradually or occur suddenly. And for some people with Crohn's disease, sometimes they may be in a period of remission where the symptoms do not present themselves and they lead a life without the usual symptoms that they used to. So some symptoms can include things like diarrhea, fever, fatigue, abdominal pain and cramping, bloody stool, mouth sores, a reduced appetite and weight loss, as well as pain or drainage near or around the anus due to inflammation from a tunnel into the skin called a fissure. We'll get into what a fissure exactly is a bit later on. Some severe symptoms of Crohn's disease include inflammation of the skin, eyes and joints, inflammation of the liver and bile duct, kidney stones, iron deficiency, also known as anemia, as well as delayed growth or sexual development in children. So now that we know what is Crohn's disease and what are some of the symptoms and some of the severe symptoms, some risk factors that can increase a person's likelihood to develop Crohn's disease. These include age. Typically anyone at any age can develop Crohn's disease, but it's more likely to develop in younger children. Most people with Crohn's disease were diagnosed before the age of 30. Ethnicity, with Caucasians having a higher risk. Family history, so if someone in your immediate family has Crohn's disease, you are more likely to develop it yourself. As many as 1 in 5 people with Crohn's disease actually have an immediate family member with the disease. Smoking can also increase your risk of developing Crohn's disease, as well as taking a non-steroidal anti-inflammatory medication, including things like ibuprofen, naproxen, sodium, and diclofenac sodium. So they have been observed to not be a direct cause of Crohn's disease, but they can lead to inflammation of the bowel that can make Crohn's disease worse. So on to the dangerous part of Crohn's disease, complications. So complications are parts of the disease which are part of a higher risk. So things like having a bowel obstruction due to changes to the thickness of the intestinal wall. Sometimes with Crohn's disease, because there's so much inflammation, the intestinal wall can suffer some significant damage and it can become scarred and narrowed. And therefore, once it becomes like that, it can block the flow of digestive contents, leading to an obstruction. Things like ulcers from chronic inflammation and can lead to open sores in the digestive tract. A fistula, as we mentioned earlier, one of the symptoms of Crohn's disease is an anal leakage from a fistula, and this is when the ulcer develops in the digestive tract, and then it can extend completely through the intestinal wall, meaning it can actually connect the intestine to another organ or another part of the body. For example, an abnormal connection between your intestine and the skin. And what can happen if someone with Crohn's disease develops a fistula in that area is that the food can actually bypass parts of the bowel necessary for absorption, meaning that that person is not able to actually absorb nutrients, as many nutrients as they can. Another thing that can happen is that loops of bowel can develop in the bladder or vagina or through the skin, causing continuous drainage of the bowel contents into the skin, meaning that the contents of the bowel aren't going where they're supposed to. They go into the skin instead of passing further along the digestive tract into the rectum and anus where it should be. And if left untreated, the fistula can form an abscess, which is a pocket of infection, and if left further untreated, it can become life-threatening. Another complication of Crohn's disease is an anal fissure, where there's a small tear in the tissue that lines the anus or the skin around the anus. As I mentioned earlier, the fissure does develop lack of ability to absorb nutrients completely, which can lead to malnutrition. And other symptoms such as diarrhea, abdominal pain, and cramping can also make it difficult for a person with Crohn's disease to actually even eat food and absorb it properly. And people with Crohn's disease, it's common for them to actually develop anemia or vitamin B12 deficiency. If you have Crohn's disease, you may be at an increased risk of developing colon cancer. And if you are taking prescribed medications for Crohn's disease, some of these medications can also increase your risk of developing other complications, such as an increased risk of infection, a small risk of developing certain cancers such as lymphoma and skin cancers. Because Crohn's disease also has an immune response portion of this disease, some medications will actually suppress your immune response, and this can also lead to a risk of increased risk of infection. And if you are prescribed corticosteroids, which help deal with inflammation, this medication can increase your risk for things like osteoporosis, bone fractures, cataracts, glaucoma, diabetes, and high blood pressure. So now that we know the dangers of Crohn's disease, what are some ways that people with Crohn's disease actually manage it? Well, as I mentioned, the doctor may prescribe different medications. One is antibiotics to treat and or prevent infections, which can lead to the formation of abscesses or fistula. Antidiarrheal medication, biologics, which suppress immune response. But they might prescribe you to have a bowel rest, where essentially you fast for several days and give your intestines several days to heal. It just gives it time to heal, and nutrition may be received through an IV or through a feeding tube. They might also prescribe corticosteroids, which help to ease inflammation, and immunomodulators, which help with an overactive immune system. And finally, they might even recommend surgery if you have developed a complication such as a perforation or a hole in your digestive system, blockages, or bleeding. So those obviously need to be rectified physically. But although we've talked a lot about what is Crohn's disease and the negative parts of Crohn's disease, how do people actually live with Crohn's disease? Well, if properly managed, most people with Crohn's disease lead a healthy and active life. As I mentioned before, there is no cure, but being able to find the right treatment and make certain lifestyle changes can help keep the disease in remission and prevent complications. Essentially, you don't have the symptoms do not present themselves because you found the right treatment and made the right lifestyle changes for your body. Some lifestyle changes include a change in diet to ensure that enough calories are consumed, because sometimes, as I mentioned, one of the complications with Crohn's disease is malnutrition, and some people with Crohn's disease may also develop lactose intolerance, and so avoiding dairy products is the best for that case. And some healthcare providers, when diagnosed, may even recommend preventive colonoscopies to check your digestive system periodically to ensure that no complications have developed. So that is all for today. Thank you so much for tuning in, and we will see you next time.